Hi, I'm Rob. I'm a gastroenterologist and I'm passionate about gut health.
Hi, I'm Cas, and as a new mum, my family's health is important to me. I've heard the secret to well-being lies in your gut.
But these days, it's hard to know what to trust online.
Luckily for me, my friend Rob is a leading Australian professor. And for 20 years, I've been picking his brain. Is leaky gut a real thing? Is the microbiome really the key to good health? Don't sausages cause cancer?
It got me thinking, if Cas wants to know more about this stuff, others might too.
So together,
We're going to share the latest cutting-edge gut facts with you.
We have the real ability to revolutionise medicine.
Our experts will be busting myths.
No, nonsense again.
and we'll be taking the tests. What have I got myself into? To tell you
The gut truth. All right, Cas.
Dr. Rob Bryant, world-renowned gastroenterologist. We're finally doing a podcast about gut health.
It's awesome. We finally got there.
Why do you feel that a podcast is necessary on the topic of gut health?
So the gut is one of the most exciting areas of medicine at the moment, and there is an increasing recognition of the importance of your gut health in your overall health. It's integral. Like, we've always just thought the gut's important for digestion and absorption, which of course it is, but it's got a far greater role than that. So we've got the science which is saying, wow, there's something really important here, coupled with rising rates of gut disease. And I think there's a lack of credible information online.
I would absolutely second that. I am seeing so much in my feed about gut health, and
Yeah.
I don't know what to trust. There's
Yeah.
a lot of information which seems to be promoted by influencers.
A very small proportion of information provided is provided by health professionals. And so many people get their information from social media. Like, if you've got a gut trouble, the algorithms will feed you more and more on your socials as to what the problems could be. And that's where I think this is really important for us to come forward and talk about what is current actual evidence and what's the science around gut health, and perhaps dispel some myths.
It's a great opportunity to really get some reliable, credible information from experts.
Absolutely, Cas, and that's why we're here. What's in it for you? Why did you think this was important?
Well, obviously, from time to time, I have my own gastrointestinal issues, and I want my family to have the healthiest life they can. And when there's so many people experiencing gastrointestinal issues,
Yeah.
and it seems to correlate with a increase in disease,
Yeah.
I think it's more important than ever that we're actually discussing this.
We need to talk about it. So often I talk to a patient and they say, yeah, my dad died of something, it was related to his gut, but we never talked about it. And I think it's really important that, you know, we're in an era now where we should be talking about these things. Poo, bums, the works.
Let's do it.
I love it.
Rob, I'm going to embarrass you here. I've asked you to introduce yourself to me, not just as a friend, but as the gastroenterologist star that you are, but you have refused to do it because you're way too modest. So I'm going to read out your bio for you. Professor Robert Bryant is head of the Inflammatory Bowel Disease Service at the Queen Elizabeth Hospital. You're research lead at the Basil Hetzel Institute, and you're a professor at Adelaide University. Not to mention the fact that you're also married with not one, but 4 children.
Yeah, got a big brood at home. Yeah.
How do you do all of that?
It's a fair old juggle, Cas, I think, between career, research and family, but I guess I'll just consider myself lucky.
Rob, how did you become a gastroenterologist, and why did you want to specialise in that area of medicine? I mean, you're dealing with poo and bums, like...
It's a good one. Everyone asks you, they go, oh, gee, it's an unfortunate line of work. Most of the patients, oh, I'm sorry you have to do this. But actually, I mean, I love it. And I say that, like, I really love my work. We're sort of like, well, you could call us the plumbers of the body. We deal with bowels, we deal with guts. Why do I love it? I've had my share of gastroenterological or, you know, GI problems in early life that I guess formed an interest and shaped my personal experience being on the other side of the bed. So I guess that's where it started for me. Went to med school, did physician training, and then took a path to gastroenterology.
What is a gastroenterologist? What do you actually do?
As a gastroenterologist, we look after people and their gastrointestinal tract. Most of what I do is clinical practice, so I see patients every week, and that's I think my main passion and what keeps me going. So a lot of what we do is obviously consultation, and we are physicians, so we use medicines, but we also are proceduralists. So we use tools like endoscopy, which means passing a camera down through the mouth, past the esophagus, stomach, and into the small bowel to evaluate it directly with our cameras, and we take biopsies. We also do colonoscopy. Colonoscopies have certainly got an ick factor.
Yeah, so what actually is a colonoscopy?
Cas, I think that's something we can perhaps show you. It's next time that I'm performing one.
Amazing, that would be great.
Let's do it.
Good morning. How are you going? A colonoscopy is a procedure where we examine the entire inner lining of the large intestine using a colonoscope. Morning, Rizzy.
Good morning. How are you?
This procedure helps us to diagnose, treat, and prevent gastrointestinal disease. This is a colonoscope, and this is the device with which we evaluate people's colons. So it really is just a long black floppy tube, and on the end of it is a camera. And with these dials, you're just twisting the tip of the colonoscope. We hockey stick it because the colon is essentially a long floppy tube. So we advance it, and that allows us to navigate through the bends in the colon to reach the end. So what I'm doing here is I've started the colonoscopy, and you can see I'm using my right hand to move the scope forward and back, and with my left hand I'm using the dials to adjust the position of the colonoscope. What we're seeing here, which is in the rectum, is patchy areas of inflammation. So there are areas of the bowel that are completely normal, but there are also areas of the bowel here which look inflamed. So what we're going to do is, on our way in, we're going to take the biopsies. Open,
Open.
close.
Closing.
You can see I've taken open,
Open.
close.
Closing.
I've taken a sample of tissue, which we will then send to the laboratory for analysis, which tells us how much inflammation is going on in the bowel wall and at a cellular level. So this is at least moderately severe ulcerative colitis, which does look quite unhappy, and you can imagine if this was on your skin, how sore this would be. So you can imagine how it feels in the bowel. These folds you can see in the colon are called haustra, which are the sort of muscular rings that are involved in the forward movement of the colonic contents. So they propel the contents of the colon down towards the rectum, which then takes you towards a poo, or opening your bowels. Now what I'm going to do now is I'm going to take this camera up into the terminal ileum, which is the small bowel. So here we are.
There you go. Well done.
Up into his terminal ileum. So what I'm going to show you now is the difference in the lining here. So what we see here in the small bowel is a very different appearance. You can see what are called villi, which are the little finger-like projections. The small bowel, it peristalses actively, so the muscles are always propelling the intestinal contents downwards. So we are done now, guys. So that's it. Thank you, team.
Other things we do are things like intestinal ultrasound. So we don't just look at the gut from within, we're able to look at the gut from the outside. So using an ultrasound and a probe on the abdomen, we can look at the bowel wall, we can look at the intestinal contents. So as a gastroenterologist, I spend most of my day talking to people about their poo.
Should we be looking at our poo?
Look, it's a taboo topic, Cas, but yes, we should be looking at our poo. The nature of your poo is an important indicator of health. We should be looking for things like blood in our poo. That can be an indicative of inflammation in the gut, even bowel cancer. We should be looking at the form of our poo, whether it be constipated, little pellets, or whether it be very loose and diarrheous. So it's important to talk about poo, and it's important to look at your own.
So Rob, when I was growing up, no one ever talked about gut health. What has changed in the last generation to make us more aware of gut health and the microbiome?
One is science and an increasing recognition of the importance of gut health to our overall health. There's been just an explosion in microbiome science as well. We've gone from fairly rudimentary techniques to look at what bugs look like on a Petri dish to now really understanding the complexity of the ecology.
The microbiome is probably a term I've only heard in the last 5 years.
Right.
What is it?
What is the gut microbiome? This is a broad term for the organisms that live within our guts, and they live from our mouth all the way down our upper gastrointestinal tract, and they're most densely populated in the lower gastrointestinal tract, which is our colon. The gut microbiome or gut microbiota is a composite of all sorts of different organisms. It's like an ecology or a rainforest. So it includes bacteria, it includes viruses, it includes fungi and archaea. So it really is an ecosystem within us.
Yeah, right. Can you just talk me through what it means for someone's lifetime of health?
Yeah, so the microbes within us assist or perform functions. So we're genetically programmed to live with a group of organisms that have a certain balance of X species with this species, and that combination of organisms and how they interact both together and with us shapes our health.
Yeah, right. I'm really interested to know, what is good gut health?
Cas, it's a really big question. I think the gut microbiome need to be balanced, happy, rich and diverse. Number two, I think good gut health would imply efficient digestion. You're able to break down the food that you've eaten and digest it and absorb the nutrients. The gut also has a big role in metabolism. So it has a huge influence on your cardiovascular risk, how you process sugars and other things, risk of diabetes. Number three, I think good gut health would imply important priming of the immune system and a healthy, robust immune system that protects against enemies, pathogens, but also allows tolerance, so you're not reacting too much to things that are normal in the environment. And number four, I think this is a really big one, is the relationship between gut health and your mental health and functioning. And I think we're learning more about the gut-brain interaction and the influence of the gut on our whole person.
I've even heard that if you change the microorganisms or microbiota in rats, you can actually change their personalities. So this isn't even just about disease and health, it's also about what makes us, our
totally agree.
personalities.
What the person, yeah. Man is a superorganism. These microbes are part of us. They're within us. The personality in rats can change with a fecal transplant. How you interpret a rat's personality, I don't know, but they probably go and look at different things.
That's amazing.
Yeah. So it really is a bi-directional or a two-way street, our engagement with our gut microbes.
It's a symbiotic relationship
It's
where
a
we get
symbiotic
benefits
relationship.
from them and
Absolutely.
they benefit from us.
Absolutely, and I think that's a key message, is that this ecology within us is part of us, and you can't think of your gut microbes as separate. They really are intertwined with our overall health, our immunity, and our global function.
Yeah, right. One of the reasons why I'm really interested to talk about gut health is I have a family history of bowel cancer, and I have really close family members who have been diagnosed with Alzheimer's disease and rheumatoid arthritis. Can you tell me a little bit about how we're starting to realise that some of the diseases that we experience are actually connected to our gut health?
Yeah, it's a really big thing, and I think this is where we're seeing such a rise of gut diseases or diseases that are related to the gut microbiota in some way. So in the last 30 or 40 years, we've seen rise of auto-inflammatory and autoimmune gut illness. We're seeing a rise in allergy, and we're seeing a rise in bowel cancers and gastrointestinal cancers. Inflammatory bowel disease is just such an enormous area of gastroenterology because of the rising rates of Crohn's disease and ulcerative colitis.
Right. And I have heard statistics that have kind of shocked me lately. So Australia has the highest rates of inflammatory bowel disease in the world.
Yeah, you're bang on, Cas, and a recent publication showed that Australia is right at the top. We're seeing such rising rates that it's heading towards 1 in 100 Australians by 2040, and it's about 1 in 250 Australians now. These diseases were very rare 100 years ago. So the first case of ulcerative colitis is described in the 1860s or thereabouts as an anecdote, and then you see ulcerative colitis described en masse in London or in these urbanised environments in around 1910. And Crohn's disease first described in 1932, and then you've shifted towards now, and suddenly you're talking about 1 in 100 Australians. Celiac disease is extraordinarily common. It is currently around 0.8% or 1 in 100. So, rates of peanut allergy are on the rise, rates of asthma. These conditions are all really prevalent now, and they weren't in fairly recent history. And I haven't even mentioned the rising rates of cancers, particularly early onset bowel cancer. The rates are just so high now.
Australia has the highest rates in the world.
Australia has the highest rates of early onset bowel cancer in the world. So it does make you wonder if this is coming from the same reason. So we're seeing really big shifts in health and a shift towards trying to manage illnesses that relate to our bodies turning on themselves, essentially, because you could put it down to changes in lifestyle, changes in the gut microbiota, and an immune system which is then out of balance and not able to regulate its response. So I think in modern life there is this concept that we are losing microbes. It could be, it's a bit sensational, but you can call it a microbial extinction event.
So our microbiome should be like a rainforest, but
Yeah.
what you're describing is like the local park in terms of richness and diversity of species. Is that the analogy you would use?
It's a great analogy, absolutely. You've stripped a lot of the trees and the plants out of the rainforest, and potentially you're left with some of the weeds. And you could say that at the moment we are experiencing an ecological disaster, which is akin to what you'd see in our environment, like a rainforest that is denuded of a lot of species. And I think that's what's happening with our gut microbiome.
So our inner world represents what's going on in our outer world, and vice versa.
Absolutely.
They're interconnected.
Absolutely. And it's a huge area of passion for me.
And so how does this translate into disease? Like, how does the loss of microorganisms within us, or microbiota,
Yeah.
how does that then lead to disease?
It's a really good question. Gee, it's a complex one too. I think you'd say that it relates to your immune system. It relates to the metabolites or the processes that those microbes create and how they function. And when you have that combination of organisms in a nice, happy, healthy community, that then primes the immune system to fight bad organisms. It also primes the immune system to regulate itself and not get too excited at certain things and become sensitized and auto-inflammatory or lead to a predisposition to autoimmune illness. I guess, Cas, my thing is that where you look at human life, so our genetics have not changed. We're the same species as we have been.
For tens of thousands of years.
Correct, absolutely. And then if you look at how our lives have changed in such a short space of time, that's where our problems are arising. And how does your gut microbiome You can't expect it to tolerate that sort of change. You've got this ecological change, this loss of microbes, and really that loss of microbes is being compounded over time. Each generation that loses microbes adopts or is exposed to the same lifestyle. So you've got the same human species, but with all these exposures over the last 100 years that have changed so drastically. With urbanisation and with a Western lifestyle, we would call it.
Like sanitation and...
Yeah. So it's a summary of factors. So I call it like a Western environmental blanket. I don't think you can say it's one thing. I think it's everything that is part of our life at the moment, because a lot of what we've done in modern life is increase our life expectancies through sanitation, through clean water source, through antibiotic treatment of infectious illnesses, because these things kill. They cause sepsis and you can die. And, you know, people lived for 30 years not that long ago. That was the median life expectancy. And now in developed countries, the life expectancy is in the 80s, and it's for the reasons. Like these are the reasons they're part of modern life. So there's antibiotics that we use often. There's data to suggest that most people in the States, for example, or in Australia will have at least a single course of antibiotics per year. We're trying to cut back on that for sure. There's a lot of antibiotic use out there, and that's just part of it, because there's antibiotics in the food chain. In some countries, because of the use of antibiotics in agriculture, there's antibiotics in the waterways. So your incidental exposure to antibiotics is really killing microbes at a mass scale. When you couple that with hygiene, which is great because it saves us from infectious illnesses that used to knock us off 100 years ago, we're losing organisms. We're so hygienic and urbanised, and many people live in apartments and don't have exposure to any green space at all, such that you're not getting that exposure to organisms, that colonisation from the environment. So potentially there is this interaction between our gut ecology and loss of microbes and a commensurate loss of microbes in our soil.
Industrial scale agriculture?
Absolutely. It's a really big change. Agriculturalisation coming in the late part of the 19th century and just becoming widespread, coupled with industrialisation, and that's just accelerated. And we're seeing with this agricultural change as well, and potentially trying to maximise crop yield and intensify that over time, that you're losing microbes in your soil. So I love the relationship between soil and gut health, and I think the health of the soil. So the soil, the soil on Earth is a really thin little layer, and that layer, that 30, 40 centimetres, has most of the organisms that then allow for healthy growth of plants.
So on a really basic level, we want to be eating fresh food that has microbes on it.
Absolutely.
That have come from the soil. So you want to pick the lettuce and eat it while it's still fresh, to maximise the microorganisms that you're ingesting.
It's very much harder to eat as we would have hundreds of years ago, which is the way in which we're genetically programmed. If you think of a human being in a forest or even in a small community environment, like a little hamlet somewhere, hundreds of years ago, you would have in your gut microbiome richness and diversity which relates closely to the soil with which you're in contact. You would have a lot more sort of parasites and helminths and other organisms that really have...
So what did you just say? Parasites and
helminths.
They're
they're wormy type things.
Right.
We would have had worms and really a lot more diversity of bugs that we don't see now. The diet that you would have been consuming would have been probably much higher in fibre, because you're foraging foods, whether it be around your hamlet or in the forest in which you're living, and that's vastly different to the diet that we're consuming now. Look at the food chain, how much has that changed?
With the advent of processed food and
100%.
ultra-processed food.
Processed food and packaged food. If you look at every aspect, food, we've gone from things that would have been foraged or grown around us that are from a natural source, to now things that are packaged and processed at just an enormous scale. If you go around the supermarket, the lion's share of the supermarket, the aisles in the middle, they're packaged and they're foods that have been processed, and probably they're totally sterile. There are 0 microbes on those food. It is only on the outside of the supermarket where you'll actually find things with microbes on them. So you're not actually ingesting new microbes at all with these packaged processed foods. If you look at trying to avoid processed foods or otherwise, they're in about 70% of the food chain. So there's studies from the United Kingdom, for example, and looking at foods and saying, can I really avoid a processed or an additive or an emulsifier or...
I think this is the thing that's really shocked me since kind of talking with you more in depth about this stuff is food additives.
I totally agree. But yeah, they're in many, many foods. I think the food industry would be experimenting with all their different food types to make sure that you buy more of it. So it sort of seems like we're playing catch up with the food industry a little bit in terms of the additives and what is being put in our food. And I think that's the scary thing.
And also, it's not just the chemicals we're exposed to in our food, it's in our environment.
Absolutely.
I heard recently that our age group is the most toxic generation that has ever lived.
Yeah, right.
We've been exposed to so many different chemicals.
Yeah, probably the health impacts of that are only being realised.
Now,
Yep.
obviously we're more sedentary now than we've ever been.
Yeah.
Is exercise another
Exercise
lifestyle
is a big
that can
factor.
change your microbiome?
Absolutely. Exercise influences your immune system, and there is that two-way street, that interplay between your immune system and the gut microbiome. Exercise also induces bowel actions, leads to...
Okay, so it helps you go to the toilet.
100%. Yeah, you're especially exercise that has gravity, you're more likely to be opening your bowels. If you look at sedentary lifestyles and office jobs, this is another aspect of Western life, and that doesn't promote movement of your contents of your gut through to open your bowels. So I think, what we see as a gastroenterologist is constipation as one of the most common conditions around. So when you put all that together, and then you've got other factors like stress, you've got lack of sleep, you've got all sorts of things that are happening as a part of our lifestyles that are leading to this change in our gut microbial ecology.
So everything in the modern world is going against our guts, basically.
And we're suffering from the consequences of that. We're actually, generation after generation, losing microbes. And I think this is where we're in a situation where we need to talk about gut health and what's happening, because it is those changes that are driving changes in disease prevalence. And like you made a really good point about, your parents and looking at what's happening to them, but we're also seeing it in younger people. We are now entering an era where we may have crossed over into changing our gut microbiome so drastically that we're now experiencing just such rising rates of these autoimmune, auto-inflammatory, allergic illnesses and cancers.
Well, that's right. It sounds like it's disease across the board. And in order to become sick, in order to get disease, your microbiome needs to be in a state of dysbiosis or an imbalanced state.
Yeah. And I think there's a lot more in the literature about an association between an abnormal or unbalanced gut microbiome and gut diseases, yes. And we call that a dysbiosis. And we used to say, is that chicken or egg? Is that a consequence of inflammation? Once you've got an established gut inflammation, do you then get a change in your gut microbiome? But I think increasingly the field recognises that the change in the gut microbiome would precede disease, and we're seeing more and more associations between an unbalanced gut microbiome and a range of different disorders. We're talking about neuropsychiatric disorders. I think you may have seen the studies on fecal transplant for autism, for example. There is an association between a dysbiosis and Alzheimer's disease, between depression, between bipolar disorder. There is also associations with cardiovascular and metabolic disorders. What we need to, though, sit back and say is that an association or a link between them does not yet imply causality. They're not the same thing. So I think further evidence is needed, but I guess overwhelmingly these changes in the gut microbiome are associated with diseases well beyond the gut that affect our whole person.
Right. Gastrointestinal symptoms and gastrointestinal issues seem to be more widespread than ever. Is that something you're seeing as a doctor?
Yeah, as a gastroenterologist, I guess you would say the lion's share of our work relates to gut symptoms. With irritable bowel syndrome is a lot of that. That is now an old term. They're better termed as functional gut disorders, or even better, disorders of the gut-brain interactions. So these are symptoms that we experience in the gut associated with changes in gut function. So it could be diarrhea, constipation, bloating.
This is sounding a bit familiar.
Yeah, it's familiar. More than half of us will experience symptoms of IBS or functional gut disorders at some point over our journey. And whilst there is no organic pathology in inverted commas, so there's no inflammation to be seen, there's no cancer, these symptoms are real. And I think the best way to see them is that they are related to a gut-brain axis, this intimate relationship between what you experience in your mind and your psychology and how you experience that in your gut. For many people, they do have a gut feeling or butterflies in their stomach, and I think those sayings come from somewhere, and we experience a lot of our whether it be mental anguish or our mental processing in our bellies. And so you're talking about symptoms that have a big impact on people's quality of life and on their function. We don't have all the answers, but there is an increasing recognition of how detrimental these symptoms can be to people in terms of, like I said, their quality of life, but more and more therapies and ways we can approach it, really disentangling this upregulated gut-brain axis and helping to settle it down and using different strategies to do so.
So stress, trauma, all these things which we've never really associated with the gut, we've thought were more kind of mental or that you'd be processing on a psychological level. We're now understanding that there's a connection going on between the brain and the gut. And
absolutely. You've got this information sort of highways between your brain and your gut. And for many people, they experience these elements of, psychological trauma or stress in their guts, and it is real because you're getting changes in gut function. People with functional gut disorders often present with bloating, which is really visible distension. They can have quite severe diarrhea, they can have pain, they can have constipation. So we're looking more at the gut-brain interactions and how we can settle it down. And even as a conventional gastroenterologist, one of my recommendations is gut-focused hypnotherapy, which has a good evidence base and can really help people and settle down this gut-brain axis.
that's amazing.
Yeah, and you wouldn't think it would be a conventional recommendation from someone like me, but it's amazing. The other thing is diet.
I think I might need to try that.
I think it's worth a crack, if that's what you're going through, Cas, for sure. The other thing that's pretty that's amazing and has come into the fore is dietary strategies for functional gut disorders. You may have heard of the low FODMAP diet.
I have, but
Yeah.
I'm keen to hear more about it.
Yeah, it's an important strategy. So you're removing rapidly fermentable carbohydrates that come into the small bowel and create a whole lot of gas, and therein a whole lot of bloat and flatulence. And if you can remove them, I guess, under supervision, a low FODMAP diet can be very effective for people.
My personal interest in this area really started to come to the fore when I started to think about having a family.
Yeah.
You really reinforced to me the importance of the microbiome.
Yeah.
Can you just talk me through the significance of the microbiome and what it means for someone's lifetime of health?
The gut is a key site for immune priming, development of immune regulation. You get so much environmental exposure through your gut. From infancy, we're sampling with our mouths and we're taking things in, which then exposes the outside world to our inside world, which is our gut. And that plays a huge role in development of our immune systems and how they function and whether they function normally, developing normal tolerance for things and not getting overactive. Yeah, so I guess having children, that's when we really start to think about where are these organisms coming from. I guess typically the first place they come from is their mother. So being born through the birth canal, there's exposure to organisms, often that's lactobacillus as an early colonizer, and then through breastfeeding, there's bifidobacteria, and all through that time, there's all the environmental exposure. So the organisms that we have within our guts are coming from our environment. They have a high turnover. They're coming in our food. They're coming with what we touch and what we put in our mouths. So I think that's really where the gut microbiome comes from, and it plays a huge role in your general health over your life and your formation of your immune system and immune regulation.
So how can we give our kids the best start then, if it is this sort of critical window then for the rest of your lifetime of health?
Yeah, it's a good point. I mean, I think the importance of setting up your gut microbiota for your children involves a good healthy diet in the early days. I think breastfeeding is really important, a year and beyond. I think avoidance of excessive processed food sets you in good stead for a good healthy gut microbiota thereafter. For us at our house, we don't have a 3-second rule, we probably have a 10-second rule. You can drop something, you can eat it. So hygiene's good, but I think, I think kids getting out there in nature and being in an environment's really important.
And what about within the household, like are pets beneficial to our microbiome?
Pets are really, really a great source of microbes. They really bring the outside in, so there is evidence to suggest that a more diverse gut microbiome is associated with household pets, so for sure.
So getting children outdoors, feeding them a whole food diet, really making sure that they have all the positive exposures to give them the best chance.
Absolutely.
Recently, we were lucky enough to ask the global medical sensation, Dr. Karan Rajan, his top tips on gut health.
Karan Rajan, welcome to the Gut Truth pod or vodcast. You don't need an introduction, but I'll provide a short one anyway. You're an NHS surgeon and a university senior lecturer, and you've got a wealth of experience professionally in managing gut illness. But moreover, you're a hugely successful health educator with 10 million social media followers, and you're active in debunking medical myths. So thanks so much for joining us.
No, thanks for having me. I'm really excited to chat.
Thank you for coming. It's a pleasure to meet you.
Karan, I just wanted to ask you, I mean, for people out there, some simple tips on how we improve our gut health. What would be 3 to 5 tips that you would give someone in your practice?
I think about the sort of inverted pyramid as my hierarchy of needs for, good baseline gut health, and, in increasing order of importance. At the very bottom, it would be sleep, to making sure that, you're getting regular good sleep. The step above that would be movement, making sure that you're regularly moving every single day as much as you can, as simple as walking. Above that, it is hydration. It is the liquid that drives our bodily functions. We need that for all the other things, but importantly, it's required for the top of the pyramid, which is fiber, especially soluble, fermentable fibers. So those 4 things in tandem are excellent, and those should be things worth striving for.
Keep an eye out for the rest of our chat with Dr. Karan at guttruth.com.au. What are some ways to change your microbiome?
How can we change the gut microbiome for health? If we sat back and said there is a link between our lifestyles and our environment, loss of microbes and changes in gut microbiome, and then the rise of these autoimmune, autoinflammatory, malignant and allergic diseases. What can we do about it? How can we change our gut microbes? And I think that it can't be overlooked that your diet, day to day, has the biggest influence on your gut microbiome.
So you mentioned a plant-based diet and the amount of meat people eat. Is eating a more plant-based diet and maybe having meat more occasionally beneficial to our microbiome?
So there are old studies which show if you go from a plant-based to an animal or a protein-based diet, you can see vast shifts in your gut microbiome, and that's just for days at a time. Right. But I guess it's not just the plants, it's probably the fibre. So I think we've probably removed a lot of fibre from our diets. Fibre being seeds, skins, roughage, essentially. Fibre is what makes it undigested to your colon, and it is fibre that the bowel organisms love. They are associated with a healthy microbe population. It allows them to make metabolites that they do when they're happy and healthy, short-chain fatty acids, and those same metabolites are what keep our bowel lining healthy.
Yeah, right.
So the positive message here is there is plasticity in the gut microbiome. You can change your gut microbiome through diet.
So on a really basic level, we want to be eating as much fresh food as we possibly can, food that isn't processed, that's whole food. But when I go to my local supermarket, the fruit and vegetable section is now some of the most expensive product in the whole supermarket. So how can an ordinary Australian who, may be struggling under the cost of living actually eat well and eat food for health in this kind of environment?
I totally agree. And I think like your home garden is probably one of the bastions of gut health. One thing I think we do need to really recognise though is that it's probably a bit rich of us to say that everyone should eat organic and have a home garden. Some people don't have the space. We both know that fresh food and organic food actually cost a lot.
Absolutely.
And it's too expensive for many people. And then we need to be advocating for ways in which we can offset the cost of healthy food, because the downstream benefits are going to be enormous in terms of health prevention and in terms of improving gut microbiome.
What about probiotics? Are probiotics a way we can change our microbiome?
They are a way we can change them. A probiotic is a live microorganism that is presumed to be associated with health. So it should be a bug that is in a capsule or whatever you're taking that is associated with health. So the most common probiotic organisms would be Lactobacillus, which is a vaginal organism, which is the first bug that is usually ingested into your guts when you pass through the birth canal. The other one would be Bifidobacteria, which is an organism that thrives in the setting of breast milk. So they're health associated because they're associated with our early life and natural processes. Probiotics are a means of manipulating your gut microbiome. Are they all proven? No. Are they necessary for good health? No. Are probiotics all benign? I think it's probably fair to say no. There's studies to show that, a lot of people use probiotics for general health and for presumed wellness. A lot of people use probiotics in the setting of antibiotics to restore their gut colonies or their gut microbiota. The issue that I have with that is there are studies to suggest that by taking a probiotic, you can actually delay restoring your natural microbiome after antibiotics. So,
well, that's something I'm interested in hearing about, having had more antibiotics this year than I've probably ever had in my life.
Yeah, and it's a really important thing that we sit back and go, what are the evidence for those recommendations for probiotics? So how many organisms? Is there a billion or a zillion, or what's the number of strains? But if you actually look carefully in that, you first ask yourself, how many of the organisms are alive? Mm-hmm. When you look at the number of strains, are they strains from a different species or the one species? Are they all Lactobacillus and just different types? So I think there is a lot in probiotics that needs to be addressed and explored, and there probably needs to be a better evidence base if we're actually going to provide recommendations.
Interesting. Do you feel like gut health has the most scope, I guess, for new discovery of anywhere in the body?
Totally biased, but of course, yes. It's such an exciting era, and in the era of gut health and this microbial discovery that we're on, alongside, emerging immune therapies, it is a really exciting space.
What does that mean?
That's this emerging field of microbial manipulation. So fecal transplant is perhaps one that you've heard of.
Who transplants?
Yeah, so it's been around for a while, it's age old, but what fecal microbiota transplantation is, or FMT, is transplanting the stool from someone who is healthy and without any disease to someone with a condition with the aim of treating that.
That sounds like a fairly drastic way of addressing your microbiome being out of balance.
Absolutely. So the gut microbiome is one of the most exciting areas of medicine at the moment, and the thought of therapeutics and manipulating our gut microbiome as treatments is just a groundbreaking frontier in medicine.
That's really fascinating, and that was a fantastic introduction to good gut health. I want to delve deeper. What's next?
Cas, I've lined up a whole team of friends and experts who are happy to come down here and join us on the couch in the basement and talk more about gut health.
I would love that. I'd love a deep dive into diet and probiotics.
Yeah.
I'd love to understand more about some of the diseases that affect the gut,
Yeah.
and also some of these treatments that you're describing, like the fecal microbiota transplants.
Let's do it.
Let's do it.
I love it.
The advice given in the Gut Truth podcast is general in nature and is not a substitute for professional medical advice. Gut Truth is brought to you by the Hospital Research Foundation and produced by Good Hope Productions.